Do you remember that huge scramble last minute to reauthorize the Children's Health Insurance Program, CHIP? It was only a couple weeks ago. Congress got it done. Or so they thought. As Alex Miller reports tonight, some states might be in trouble as early as next week.
It was one of the last things Congress took care of before going home for the holidays, and now it may be one of the first messes they've got to clean up in 2018.
We should have done it a long time ago.
The Children's Health Insurance Program, a bipartisan effort to fund healthcare for needy children for the last couple decades, is running out of money. Again. Congress reauthorized CHIP through March of 2018 back in December. Now some states may lose that money as early as next Friday. Congressman Dan Kildee of Flint, Michigan wants to make funding a condition of the budget deal, which coincidentally needs to be done by the end of the month. Bob Moffett of the conservative-leaning think tank The Heritage Foundation says this has become a missed opportunity for Republican leadership. He says the funding, which is at the center of the dispute, is not the problem. What is in the bill is.
Let's give an extension right now for the next 6 months, and over the next 6 months, sit down, work with the Democrats, and hammer out a well-crafted, competent children's health insurance program bill, and do it without the hysterical last-minute Chinese fire drill approach that we've been using on this issue and so many other issues in Congress for the last 10 years.
Right now, GOP leadership wants to use money from Obamacare's prevention fund to pay for the program. Congressman Kildee likens it to robbing Peter to pay Paul.
It sort of defeats the purpose of CHIP by taking health prevention funds, which are part of the Affordable Care Act, to pay for children's health care. We essentially punish the same population.
Well, I don't think it makes any difference. It's federal money. In one sense, it's taxpayers' money. People who are low income are going to get subsidies if they're low income, whether they're in CHIP or whether they are in the Affordable Care Act.
Kildee proposes instead making the program permanent through an entitlement, something House Speaker Paul Ryan talked about reforming this year.
You know, he needs to be specific about what he means when he says that, because rolling back entitlements, is he talking about cutting Social Security? Is he talking about cutting Medicare? I mean, that's where a lot of that money goes. My view is those are important social insurance programs that ought to be strengthened, not weakened.
Regardless of future plans, the program needs another deal, and fast. It's going to be up to the leadership to make sure that something is done before these states run out of money.
I spoke with Alex today here in the newsroom about the timeline for getting all this done again, and what this could mean for Kildee's hometown district of Flint, Michigan.
Alex, you've been watching this issue closely for years, reporting on the Hill and for us also here at Newsy. So one thing I think is interesting is that the CBO score on CHIP has actually gone down, what it would cost.
Yeah, it has. It's gone to $800 million from about $8 billion for a 5-year extension. And that's actually because of what the Republicans did with the tax cuts. Because they got rid of that Obamacare individual mandate, now they're expecting people, if they get rid of CHIP or don't fund it, to use that to enroll in Obamacare, and that would make CHIP cheaper by comparison.
The price tag would go down. Also, something CHIP does that a lot of advocates have pointed out is that it encourages preventive care, wellness visits, which means that you don't get these symptoms or diseases compounding to where you end up in the emergency room with a $100,000 bill.
Well, and that's what a lot of Democrats are saying is that, you know, by funding CHIP, you're taking care of people down the line and you're cutting costs down the line because they might not need to invest in that kind of care for adults if they took care of people as children first.
I think we should also acknowledge, as we've done in previous cases when we've covered this story, is that you and I know a lot of Republicans on the Hill. They're not heartless. They want to help children.
Absolutely.
They have a different way of going about it. They're trying to hammer this out. What are we talking about with timeline?
Yeah, I mean, the reality is both sides have supported this issue from the get-go, and they do now. A lot of people have told me that it's really about the policy. They're starting to get how they're going to pay for it down, but some Republicans want to revamp because CHIP makes it more difficult, they've found, for kids to go see specialists and things like that. So they're also looking at how to fix that. The spending bill needs to be done by next week, so they're trying to decide whether they're going to tack it onto that spending bill, also known as a continuing resolution, or whether it's going to be its own funding bill.
And when you hear CHIP, you think child health insurance program, you think health insurance, going to the doctor, going to the dentist, what have you. But you found out from Representative Kildee, this actually extends far beyond that.
Absolutely. I thought that, you know, same thing as you. It's for wellness visits and checkups and specialists. It's for a lot more than that. Congressman Kildee represents Flint, Michigan, which we know was devastated by the water crisis, and they're trying to rebuild now. And he told me that not only are wellness visits obviously included for many children in his particular district, but also pipes that need to get rebuilt, put in homes, lead abatements, things that you might need down the line to make sure that these kids don't have the same problem 20, 30 years down the line when they're grown and when they have kids of their own.